That's right. And it makes it more intimate. Yeah.
He's doing it.
Oh, no, I just did
Safe
it.
travels. You
Oh,
flying
okay.
out of here?
Yeah,
Or
I
you
went on
gonna
your
do it?
computer and spotlighted.
So enjoy
appearance,
the
like,
beautiful
for everybody
day.
to see.
Thank you so much.
So that way they can see.
So that wasn't on my computer?
That was on your computer.
What was that?
Wasn't it? Stop doing it?
I guess, I don't know.
What was it? What was it?
I don't know. I had it set up where all I saw was the speaker on my computer, but they just said it wasn't.
Yeah, if it moved to somebody else, I just hit spotlight or speaker,
Maybe because we changed cameras.
probably. And so we just did spotlight speaker. No, it's just not going to show the speaker. It's just- it's Normally show here. Spotlight.
This,
Okay.
it's this space right here. Yeah. So, okay, I'm gonna kick it off. This because people struggle with. Okay, everybody, did you have a good lunch? I heard all the buzzing energy, good energy, talking, getting to meet new people. How many people met somebody new? Good, good. And how many got to meet somebody from last time that they got to reconnect with? Good, buddies. That makes a difference. So we're past lunch and we've got some great speakers. So hang in there. I know you can get a little bit of post-meal drowsy, but hang in there because we've got some great information to share with you. I do want to remind you to fill out those patient the evaluation forms, the blue forms. Let us know what you want to have for next year, what you're curious about, or anything we can do differently. And if you didn't get a chance to reach out to our support group leaders here, try to, if you feel like you're ready for that. So we've got Patty Newman and Sarah Budd and Lakeisha Williams here. So reach out to them because they're online support groups. So there's a possibility that even if you can't be in their vicinity, you can still join and learn some things through community. So we're going to transition to our afternoon sessions, and we're going to kick it off with Kate Anastasia. And Kate is joining us from National Scleroderma Foundation, the head office. She's going to give you some updates about some things going on with the foundation and things going on in our area with our region. And Kate comes with over 20 years of experience working with nonprofits like the Arthritis Foundation, Lupus Foundation. What was the other one you worked with?
Alzheimer's.
Alzheimer's. So she's come to the Scleroderma Foundation with a lot of experience. We're going through lots of adjustments with how we're organizing ourselves. And so it's helpful to have somebody who's been through it, and we appreciate everything she's doing. So you are in charge of mission,
Thank you.
right?
Yes.
Thank you.
Hi, everyone. And to those of you online, I've been the woman behind the computer all morning. So nice to meet you. And I want to thank, I know there's been a lot of thanking going on, but April is also National Volunteer Appreciation Month. So I feel like it's really fitting to thank all of you again, including the support group facilitators who are here in the room. But I mean, Francis, Susan, I'm so upset that I didn't get to meet you in person. Karen, Sarah Smith, Carol, Dr. Silver, all of you, everything that you did to make this happen. I'm so excited to be here. And I just wanted to make sure you knew that. So what I'm going to start off with is June is Scleroderma Awareness Month. So I wanted to start off with some of the activities that the national office is going to be rolling out for everyone. So we're going to start off with inviting all of our constituents to share their stories. So there will be a number of different opportunities that'll come out on social media where you can share videos, audio segments, pictures, but we want to make sure that everyone's sharing their unique journey and their unique experience. So that'll be coming out in our e-letters. There'll be specialized e-letters going out for the chapter if you're not receiving the national e-letter, and then just posts that you'll see on Instagram, Facebook, LinkedIn, all of that. Our Teal Talks. So we're rolling out our Teal Talks again, which are educational, but they're not formal webinars. They're more conversational, so 15, 20-minute sessions where they'll be live streamed on Facebook. People can join in, ask questions. We're still working on those, but we know we'll have at least 4 of these Teal Talks that will be rolling out. I can give you a sneak preview. One of them that we've concerned will feature our very own Dr. Carol Fagali-Bostwick and Dr. Cassie Twarek, who will be talking about some of the research, both adults and children. So that'll be one of them that's super exciting. The individual light-ups and proclamations in the pictures that were rotating as you first came in, you got to see some of the proclamations that you can get from your elected officials. There are also videos available on our YouTube channel that can talk to you about how you can make recommendations to get those proclamations and where you can find certain buildings that can light up. So for myself, I live on Long Island. I live in Nassau County. There's a court building in Nassau County where they will light it up. So the executive director from Tri-State and myself, we reached out, and in Nassau County, that government building will be lit teal on June 29th. So we can help you with doing that, but it's really just a great way to raise awareness about this disease and get people talking about teal. And then, of course, I'm really excited about the variety of foundation branded merchandise that we're going to be rolling out. So we're going to have like lawn signs that you can put up, and it's just to get people to start asking you questions. Also, my personal favorite, I have a dog. We're going to do those doggy bandanas that you can wear too. So yeah, just all different on the dogs. Yes. Yes. But just all ways that we can really start to raise awareness. So that's for June and more to come on that. Another piece, and this one is super exciting for me because I started working on this day 1 last year in June when I first started with the organization. And these are going to be our somewhat community assessments. So we're building off of our Teal Talks, but now we're including a real talk. And these are scleroderma listening sessions. And we're going to roll our first one the end of this month. But what it's really about are community conversations. They're going to happen virtually to start, but we are going to then start moving them to in-person settings as well. So you will join a Zoom meeting, but the presentation is going to be the first 5-10 minutes just to kind of set the stage, manage expectations, but the whole rest of the presentation is going to be guided conversation. People facilitating, we have maybe 10, 15 questions, but it's going to be all about folks weighing in, providing their unique situation, their unique journey, their unique feelings. And we're going to start by doing them within chapter territories, then within state territories, and then just looking at different community for caregivers, for people who are newly diagnosed, maybe for young adults. And these are really meant to help us understand gaps in our programs and services, unique needs that maybe we're not meeting, or maybe we already have a program or service that people don't know about. That's on us then to do a better job of making sure people know we have a Hope Line. We have access to all of these education programs. That local in-person education programs are happening throughout the country. So to be on the lookout for this. Our first one, as I had said, is going to be at the end of the month, but we're piloting it with just support group facilitators, hoping that they can help us refine the questions that we should be asking. And then this is not a time-fixed program. This is going to be ongoing, that we're going to continue to solicit feedback from our community. Also, our stepping out walks, another way to really raise awareness. I had the opportunity to attend one last year, and just being in the park, a number of people walked by and stopped me and said, "What are you guys doing here? And what is scleroderma?" And it really gave us the opportunity to talk to people. And, you know, it can be a very isolating disease, but everybody can come out and just spend the day raising awareness and coming together. And for the Southeast chapter, June 15th in Lilburn, Georgia. And if you'd like to learn more about maybe starting a walk, even if it's a small walk in your own community, your own neighborhood, just reach out to us. We have, you know, development staff that can help you start to finish and start one in your own community. This is another thing that I'm really excited about. And yes, I did highlight our MUSC folks, but as many of you know, if it's really difficult to find an appropriate provider that can diagnose, provide quality care, talk to you about different treatments and medications. So the National Scleroderma Foundation had rolled out its designated scleroderma research treatment centers. And it's a great program, but it does require the center to meet certain guidelines. They have to have a multidisciplinary approach, so multiple specialties. They have to be providing community education like a program like this, and they have to be involved in research. So that's great. That's the type of entity I would want to go to for my care, but we know that they don't exist throughout the entire country. And there are folks that need access. So we expanded the program to also include certain community-based physicians or maybe great academic centers, but they don't meet all three. Maybe they're not doing research, or maybe they don't have the ability to do an education program. And then we also realized that there are other centers that might just specialize in, lung care, or might specialize in GI care. And we want to make sure that we can recognize all of these different centers and expertise on our website. So we created, thanks to our Medical and Scientific Advisory Board, Dr. Silver, I have to recognize you here as well, but we have a universal application now where our Medical and Scientific Advisory Board can review all of the applications and say, this one meets the criteria for the designated Scleroderma Research Treatment Center, this one is a specialized center, and it's really going to help our constituents find better care, access to getting a diagnosis. So we're excited about that as well. And of course, our conference. I could not leave here without talking to you about the national conference. This year, we will be in Bellevue, Washington, which is very close to Seattle. It's maybe a 20-minute ride from Seattle's airport. We have about 47 sessions scheduled, trying to reach for newly diagnosed, our existing scleroderma warriors, caregivers, young adults, just making sure that we're meeting everyone's needs. Unfortunately, the scholarship application has closed, but keep that in mind for the future down the road next year. But I do hope that you can join us. It's similar to this amazing experience. And I think it was Karen who said it earlier, the connections that I've been able to witness every time I'm at an in-person event like this, I just think, lifelong. And if you get to do this, and if you can make it out to Seattle, it would be wonderful. Yes. And we do have the next few scheduled, but it's kind of a mum's the word. So you'll find out at the end of Seattle where we are the following year. But again, we are rotating throughout the country. So actually, I'm going to go back one. So I'm excited about this, and I was not going to initially bring this slide and talk about it, but the National Scleroderma Foundation has entered into a partnership with Komodo Health. So Komodo Health, Carol, you may know about this or maybe not, but they work off of de-identified insurance claims. So they get all of this data throughout the country. They started in about 2012, but saw a significant increase in 2015. So they get all of this de-identified information through insurance companies, through electronic medical records, through pharmacy records, and they're able to pull all of this together. And we can, as the users, we can create these cohorts or profiles or queries. And it's really starting to help us better understand the disease, where folks are located, the healthcare professionals that they're seeing. And when I say it's new, I mean, I've been futzing around in it for 2 weeks. So I was a little nervous about pulling this, but how many people do you think in the United States have scleroderma? In the United States? Okay. I'm gonna go. All right. So the top left corner, 296,000, which we've been saying 300,000. So this does pretty much confirm what we've been looking at. So the 353,000 next to that, that's the number of healthcare professionals who are seeing scleroderma patients in these unique visits. But that doesn't necessarily mean that they are a doctor. It could be the pharmacy. It could be where they're getting blood taken. And then the healthcare organizations, the number of payers, and that's the last one is the number of visits. So this is for the entire United States. And I should also mention, I wasn't able to pull the entire profile, but who do you think was the #1 healthcare professional seeing the largest number of scleroderma patients? Excuse me? Yes. Who do you think it was for the Southeast chapter? Yes, it was. So I then quickly this morning pulled for the Southeast chapter. So North Carolina, South Carolina, and Georgia, and about a little over 19,000 just in this chapter area. And I should say, not that I understand completely the technology behind it, but they are unique visits. When a person is entered into the system, they're tokenized. So in the background, we know that they are unique visits or unique individuals, I should say. So we're really excited about this because as we start to use it, we can put in specific criteria to say the number of people who are diagnosed in a specific area that might also have a different set of symptoms. We can use ICD codes. We can also take a look at maybe folks, we want to know someone who's been diagnosed for less than this amount of time and using a specific medication. So the sky's the limit here, and we're really excited about this new technology. But just to start off, that we had been saying 300,000 for all of these years, and to get that kind of information, we're on the right track. So with that, I just wanted to thank you for your time. Do I have time for a couple, if anyone has questions?
Thank you very much
You
for
got
the
it.
update. So-
Thank you.